Hi, and welcome to Reinventing Nerds. Today we have Nihar Bhakta on our show, and I want to tell you a little bit about what he does. He is a project team lead at Gossamer Bio. Nihar has started out as a kidney transplant physician, that's his training, and he's also been in biotech and pharmaceuticals for about 14 years now. He has lots of interesting stories to share with us today. So let's jump right in and say, hi, Nihar, how are you?
Good. How are you doing, Joanie?
I'm great. I'm so glad to have you on our show today. And I'd like to start out just by hearing a little bit about your job and what you do. Tell us what you do.
Sure. So my role is I'm the project team lead here for one of our assets at Gossamer Bio. We have four assets that are in the clinic or close to being in the clinic. And uh, a lot of my responsibilities really revolve around ensuring that all of the various items that we need to get done on our project teams get accomplished, really. So it's really enabling and helping the team to get through decisions, key pain points, et cetera, and also making sure that the team collaborates. One of the things that's vital to any team, as you and I have discussed in the past, is that ensuring that we have good lines of communication where there are challenges or issues um, are resolved. And so I think that one of the things that we really spend a lot of time focusing on as project team leads is really ensuring what needs to get done, what's the important work that the team should be focused on, how can we work best together. And a lot of that has very little to do with my training as a physician, or in terms of what we do um, in terms of what we do from a broader perspective in drug development. It really is around how our teams function and collaborate together. So
Wow.
it's interesting in that
Mhm.
things um, how you get the work done is just as important as the work that you're getting done.
Well, I couldn't have asked for a better sell for this show. So tell us, what does that mean? I mean, in engineering, that's also the case, but in pharmaceuticals and biotech, how is that you didn't have this training for what you're doing?
Yeah, so I think one of the things is that we're trained as scientists, and the data really drives so much of what we do. And experiments, how you conduct the experiments, it's really important. And we all are trained in terms of making sure we're designing the right experiments and the best experiments. But what we don't realize is that we have a lot of different people who have different thoughts about how to design the best experiments, because no one knows everything. And I think that that's really the important part, is trying to get people to collaborate and think through, how can we design the best experiment, not how can I design the best experiment. Because I think that that's the one area that every scientist has a blind spot in, that individual people can drive great successes, but if you ask almost any great scientist, there's always a team of people who they've worked with, there's always people who collaborated with them, or there's other people who they base their work on. And so we recognize, most scientists, when they get to a certain point, recognize that we all collaborate in some capacity. And I think that that's the really important part of what we in biotech do, is really understanding how to collaborate so that we can do the right kind of science.
Okay, so collaboration is huge. I'm thinking about in schools now, sometimes they do collaborative work, but a lot of it is still individual based. So how did you learn these skills and how to collaborate?
Uh, most of it was trial and error. I'd say that a
Mhm.
lot of the skills that we have. You're absolutely right. Most of it is being an individual contributor, or learning how to design things, or getting the right answer, designing the experiment right, getting the best yield in chemistry. All of those things that we learn. Getting the answers right on every test, knowing the biology,
Mhm.
learning about the different diseases or the pharmacology and side effects. It's all stuff that you have to do individually, and that's how you get your technical expertise right. But
Right.
ultimately, when you get to what we do in biotech and in drug development, you have to apply the science of what you've learned, whether it's on a specific pathway, whether it's about how your drug is absorbed, whether it's about how different, how you might manage different side effects that your molecule might have. All of those things are things that are really applications of what you've learned to date. And I think that the application of that work a lot of times is driven individually, but really sometimes it's interpretation of what that data, what comes out of those results. And the interpretation can be a very collaborative effort. And I think that that's the one thing that for us at my company in particular, but really on almost every good team that I've worked on, it really ends up being a collaborative effort. There's rarely one person who takes all of the responsibility for any success or identification or anything like that. Usually it's a team of people who've worked on things. And so, I think that the one area that within biotech and pharma that's really important is that we recognize how best to identify, those issues and talk about them and collaborate on them.
Yeah, that's so interesting because, some of what I was fixated on while you were talking here was about how you need to learn that expertise. So in some ways, you do need to focus on the individual part going forward, but then at some point, you have to be able to work on the collaboration as well. And that's, the trial and error, working on teams and doing it in the workplace on the kind of projects that you're on, right?
Yeah, no, you're absolutely right. I think, I think the expertise that people bring is all developed. A lot of it's developed in isolation. Chemists working on, getting better yields, or chemists working on identifying a simpler process, or our biologists working on, different animal experiments. But what we end up, ultimately getting to is that those people all need to get into a room and talk and figure out how we can move that molecule or move that drug forward so that we can ultimately bring it to patients.
Right. So the other thing I really picked up on was the interpretation piece. And you're not just talking about this teamwork, but you're talking about an intellectual piece of this, how to collaborate on interpreting the science. That's something that I haven't heard a lot about. That in terms of just the ideas, that you have a better idea, like the sum of the parts is greater than the whole when you have a team or.
Yeah, so I think that that's something that I've learned over really more recently in the last 4 or 5 years as I've worked on different projects that have ultimately tried to get drug approval, get a new medicine approved. And I think one of the things that really comes out of that is that when there's data, and a lot of times there's data is complicated. It never gives you a black and white answer. A lot of times it's gray. One piece of data leads you down one path, and another piece of data from the same data set might lead you down a very different path. And so, a lot of times for one person to think through all that can be overwhelming, really daunting, and make it so that you don't really feel like you can actually, think through it and figure out what the right answer is. And the one thing that I found is that a lot of times when you get the smart people in a room together talking about what do we think the key pieces of data mean, you can really come to kind of an aligned interpretation about why, the data means what it means, and really feel that you're comfortable with that. And, everyone can get on the same page. So you're right. It is different than, than a lot of times what we're taught to do, which is you're supposed to interpret the data yourself and come to your own conclusion.
Yeah, right. Oh, that's so fascinating. Because I often talk about the people skills just in terms of how you interact with others and lead teams and all that. But you brought up another layer of this, of just the collaboration and the intellectual piece of the science. But I'd like to also talk about the whole people side of it. You've been leading a team now. How long have you been managing a team?
Yeah. So in terms of, at this current company, I've been here for about a little over a year. Prior to that, I was at another company where I was also leading a team through a filing, and that was for about 2.5 years. And really, some of those skills that I said that I've learned, have been through those experiences. Some of them really I learned actually a long time ago, and I just didn't realize that those are skills that I probably learned a long time ago.
Yeah.
That now that I reflect on it, part of it is age. Obviously, as the more experience you get, the more you realize that there are certain times in your life where maybe you should have handled things differently, or maybe you weren't in the right space to understand the lesson that you learned that at that time.
Interesting. Do you have any examples of such learnings?
Yeah, absolutely. So I think one of the examples, and I was talking about this with my wife, who's also a physician, is that during training, when we're residents and, in our fellowship programs, a lot of times, there's a lot of education that goes on, and a lot of times there's, people who you need to mentor and help them to, improve how they are practicing physicians. And that's really the role of a senior resident or an attending physician for the interns. And, one of the things that, and I'm not proud of this by any stretch of the imagination, is one of the things that, my wife reminded me of is that I had a proclivity for making interns cry in residency. And it wasn't because I was yelling at people, even though there are some residents who have that capacity. It was because I would be talking to them about, science, or trying to educate them on what they might have done, which wasn't appropriate for the patient. And that really led to some very difficult interactions. One example in particular, I remember I was working in a cardiac unit, taking care of very small children post-operatively. And there was a patient who had a low sodium. Now, a lot of the electrolytes that are in your body, you see even those Gatorade commercials where they tell you need to replenish your electrolytes, right? And so a lot of times, depending on what the electrolyte is, you can just add a little bit more of that electrolyte to the intravenous fluids that the patients are getting, because they're really not eating immediately post-operatively. And it's pretty common that you do that. You modulate those up and down. Sodium is a little bit different, though. The biology and the physiology of sodium is such that it's actually a little bit more complicated than that. You need to understand why the sodium might be low. And, you need to think about, in the setting that the patient is in, this is a post-operative setting, they've probably gotten a lot of IV fluids. It actually might be because the sodium is slightly diluted, in terms of it's usually a problem of water, having too much fluid on board.
Okay.
And so you need to think, you need to think that through, but you always need to think it through in the context of the patient, that you have in all of the information and the data that you have. So this intern came to me and said, oh, this patient's sodium was low. I increased the sodium in her IV fluids. And I said to them, that doesn't sound like a good plan, because, and I asked her for a few other pieces of data, which she didn't have, specifically around, what did the urine look like, and a couple of other pieces. And, when she asked me, well, what's wrong with what I did? And I tried to explain to her that, that can actually be sometimes a dangerous proposition, to increase the sodium in someone's IV fluids, because it can lead to some other side effects. And now nothing had happened with this patient. And actually, she had written an order that hadn't even been taken off. We promptly walked over, crossed the order out, and decided to manage things a little bit differently for that patient. But the intern, she was a very good intern, and she really was very conscientious and thoughtful, but also she was kind of exhausted because she was working crazy hours. And she, as I think every physician has at some point, kind of started crying. I mean, I know I've done it myself, and it happens. And it's interesting because I look back on that interaction now and I realize, I probably should have handled that differently, because I should have recognized who that, what position that intern was in, that she was exhausted. I think she was post-call even, where she'd been up for, at least 24 to 30 hours. And even just walking her through something in a very scientific way, which I thought was perfectly reasonable. If I look back on it now, I think maybe I should have handled that differently. I should have been a little bit more thoughtful about who I was talking to and what mind state she was in, before I started saying these what I thought were very scientific words that ultimately, ended up causing her to not feel, to not be in a very good place. And so things like that, I think, are very common for physicians and scientists. They don't think about the fact that when they're talking about data, sometimes data, you need to realize who you're talking to that data, what mindset they're in, and how willing they are to receive what you're talking to them about. I'm sure if we had that discussion at a different time, she wouldn't have interpreted it in the same way. But that's something that I've learned through the years, and I'm now really cognizant of that now, almost 20 years later, because I realize that anytime I'm having a discussion with someone, even if it's around data, I need to first get a feel for who I'm talking to.
That's really good example there, because when you talked about data, just, I mean, so many people think about data as just being, it's logical, it's rational, it speaks for itself. Why would we have to worry about how we present it, and that's the way to prove a point. But you're saying it's actually where someone's coming from, what state they're in, and how they feel about the data, how they feel about the way it's being interpreted or whatever, or the way it's being conveyed or communicated. There's so many different things there. And it's not even just their feelings, but it's also, you're talking about somebody who's been working long hours, they're exhausted, and really understanding the people side of it. You're not just sort of crunching numbers in a computer, you're talking to a human being. And that comes up in so many different ways, not even just in a hospital. I'm sure it's also, if you're working at the biotech company, people are working long hours on something, and the data comes back and you're just explaining it and you don't really think about where they're at. You could certainly make someone cry there too, I'm guessing. You don't want to anymore.
Yeah. No, you're absolutely right, Joanie. It is funny. I mean, that's the one thing that I realize is that, people really want to do their best. Everyone comes at it from just, really good intentions. And, you have to take that mindset with the people on your team, that people aren't intentionally being difficult or aren't intentionally, not being collaborative. They're coming at it from the best, best of intentions. And so, the way that you have to realize that you have to, when you're talking with folks, talking through data, understanding, trying to come to a mutual understanding around data. I think that, understanding the mindset of where they're at is absolutely important. If it's someone who's been killing themselves, crunching through numbers, working till, all hours of the night, trying to get things done, and you are trying to talk to them about why they need to do more to understand the data, you need to understand that. You need to be really, cognizant of that, because sometimes, that gets interpreted as you're asking me to do more work and have already done so much more work already, right? Even though what you're trying to say is that we need to come to, we need a little bit more clarity around what the data you've already showed us has given us, right? Like you've walked us down a really good path already, but we need to, close it. We need to go those last 10 meters or 20 meters or whatever it is. And we need your help to do that. And you need to understand that sometimes that can be really hard for people to take. And I've been the one who's received that news, and it's been hard for me to take, where I've already done a ton of work on filing, worked on closing out multiple studies. And then, there's additional work that's being asked. There's additional analyses that need to be thought of, or additional, documents that need to be written. And it can be overwhelming at times. And, having done the work and now also, leading people who are doing the work, I'm always cognizant of that, because, it isn't that people don't want to do good science. It's that people really need to understand why you're asking them to do the work, or why you think that you need to get more data.
So do you have a way of encouraging people or celebrating success to a certain point, or is it just really, there's no time for that? You just have to keep plugging and helping them understand that they need to be in there for the long haul?
Oh no, so that's one of the reasons I really enjoy the company that I work at now, is that that's actually part of our ethos. I mean, we celebrate our successes along the way, and we know that we don't always achieve, get to celebrate lots of big milestones all the time. But when we hit them, we want to make sure that we celebrate them, and even the smaller milestones. So the first patient who gets enrolled in a trial, it's just the first patient. There may be hundreds of more coming after. We celebrate those milestones because those are really important. There's so much work that it takes getting a patient, enrolled into a trial. Or the first time, I still remember, this was a year ago actually, where we had commissioned just some, on one of my other projects here at Gossamer, we had commissioned a little bit of work to better understand the biology of how our drug works and how it's metabolized. And that when we've got the very first data from that experiment, like, it was super exciting. And it was one of those things that just within a team meeting, I, just wanted to recognize all of the team members who put so much effort into getting that one experiment conducted and done. It took them about 2 months to get all of the data from that experiment. And it was one of those things where it's like, we conceived this experiment here in a room 2 months ago as a team. We were a new company, And now we have data that we've generated as Gossamer Bio. It was really exciting and fun. And so we have to do that along the way, because if you don't, it's so easy to lose sight of just, keep working harder, keep doing more, and then ultimately you burn people out. And then, no matter how great people are, it's never fun to come to work if you don't feel like you're appreciated. It just isn't.
Right. Yeah, the burnout factor is huge. So what else do you do to help mitigate that?
So I think one of the things that we try to do is always to make sure, especially in my role, is to make sure people have enough resources. Sometimes the resources are monetary. Sometimes it's just allowing them to, have the funding to get their projects done, right? Mm-hmm. So that they can, go out to a vendor and get it done. Other times it's human resources. Maybe it's finding a consultant to help pitch in for a couple of months. Maybe it's finding someone who can help crunch through some numbers with that. Maybe it's finding a statistician who can help, or a programmer who can help to help support things. And all of those things are really important, because, ultimately those are the types of things that help people avoid burnout, right? Mm-hmm. That they know, because they'll also be more willing to raise their hand. I know I'm the one who raises my hand sometimes to my management, because, there's just too much to do and we're asking too much of the team. And, that I think that's important, because you never want to burn people out, but you also want to get things done quickly, right? And it's a fine line you're constantly walking. It's that, there's always, for us at least, there's always a patient waiting, right? The faster we get things done, but we have to do it the right way. We have to design the right experiments. Right. The faster we get it done, the sooner that new medicine that we're working on might become available for patients who are in need. And so, we want to do things as fast as we can, but we recognize that if we lose people along the way, that we're actually not doing it as fast as we can.
Right, it'll take longer.
It'll take us longer, because we got to bring someone in new, get them up to speed, right? And so we're constantly balancing that, and we don't want to lose people. We don't want to have attrition. So, it's hard. I don't think that there's a good answer, unfortunately. I think within our field, it's this constant tension, and we have to, as leaders within our organization, but also within any individual sub-team or project team, we have to recognize that there's a fine balance between burning people out and driving people toward getting things done. And I think the way that I found is authentic, at least for me, is that I always try to help. So what can we do to help? If you ask those, most people will tell you that they need help, or they will at least know that there's someone who can help me should I need help down the road. And I think that's really important.
As a manager, what can I do to help? I mean, those are just like, what, how many words? What can I do to help? Like 5-6 words, I mean,
absolutely. Yeah. And people don't want to hear that, right? People, it's funny, because a lot of times people think, oh, am I doing something wrong? And that's really the wrong culture. And in some corporate organizations, when a manager says that, it gets interpreted as, I'm not doing my job.
Okay.
Right?
So how do you
So you have to build that from the beginning. You have to build it from the beginning. When we ask the question, what can I do to help, or how can we better support you? We're being honest. You just have to it can't just be said once. It has to, it's part of the constant, when you come into work, it has to be honesty and transparency and humility, really. And when you do those things, people believe you then. And if your team believes you, if they believe that you're going to follow through on what you say you were going to do, that if you said you're going to get them more resource, you go and get them more resource, or if once you build that trust, that's how you can keep people from getting burned out, because you realize that, and they realize that, oh, we're in this together. We know that we have to get these things done together, and that there will be support when I need support.
How did you come to these conclusions? I mean, I want to know about when you transitioned from individual contributor to a team leader. How did you know what to do, and how did that go for you? Like, maybe what are some things that you had to think about, or that were struggle with at first, that you overcame to get to where you're at now?
Sure. So I think, though, one thing that I guess I'll start with the easiest thing for me, at least, is what were the things that I didn't like, when a manager told me to do something, and just start with that, right? What are the things that kind of were my trigger points? and obviously trying not to bring those out when I have to lead a team. So, and the things that always got me set off were, people who, would micromanage me, or people who would, ask me to do work and then never use it, like those kinds of things, right? And so, that's the basis of where I started. But honestly, a lot of it was trial and error. I mean, you hate to say it, but it is the truest known scientific method, right? Which is, you have to realize that, over time, I've realized that there's no one approach that works with everyone and on every team. You have to realize who's on your team. What do they respond to? Some people really respond to, being very data driven, and everything is, you need to show them metrics. Other people very much want to just be heard, that they just need 10 or 15 minutes of, time with whomever the leader is to let them know what their concerns and their complaints are, that they've been heard, and that they might be addressed moving forward. So it really does depend on the team that I'm working on. And I've, fortunately in biotech and pharma, but I'm assuming this is true within a lot of scientific fields.
Oh yeah.
Is that you work with a variety of personalities, and having some degree of, for lack of a better word, I guess, emotional intelligence about, who you're talking to, who's on your team. I think that's probably the most important thing. Really try to learn about those people. Try to learn what drives them. And then that can help you figure out how to get your team into the right place.
Wow. Yeah, that's just huge. It sounds to me like you've put a bit of time and effort into figuring that out. But it also sounds like the trial and error method, you have to be willing to take risks and make mistakes. And how do you get through that? I mean, one of the things I hear a lot from new leaders is this idea that they won't be seen as a good leader if they make those kind of mistakes. So how do you push through that?
That's a great point, and that's something that you constantly struggle with. How do you reset if you all get off to a bad foot, right? On a new project or a new team, if you do make some of those mistakes. And I think that the way that you can reset is by really being humble. Honestly, is like recognizing and owning your mistakes and saying, I made a mistake here. Telling your team, hey, I screwed up.
Wow.
At least for me, that's very, it's hard for people to own that, right? Because we're all supposed to be great. You get to a good position, project team lead role, whatever the role is that you have, and you don't get there by being a screw up, right? You get there by actually being good at what you do and being competent. But I think that one of the things that most people respond to, because we've all been there, we've all done something, we've all screwed something up. I think most people like it when someone's honest and humble about it and just says, look, this wasn't the right call. I get it. We made a mistake. So when I make mistakes like that, I try to be very humble and honest with my team and just say, I made a mistake here. I thought we should do X. That was the wrong way to go. Or I've, been pushing you to do Y, and you guys are telling me I needed to do X, and you guys are absolutely right. And, and owning that's going to get you a lot more cachet with your team than trying to ignore the fact that you were pushing them down one path when they were telling you to go to another path.
Yeah. So being humble and authentic and honest with people.
Yeah, I mean, at least for me, that's what works, right? If you're willing to try different ways of working with people and try out new things, you also have to be willing to risk failure. And when you risk failure, it's way easier to risk failure if you're willing to come out and say, yeah, you know what, I screwed up. That wasn't the right way to go. You guys knew the right way to go. I didn't. People are going to be actually pretty responsive to that for the most part, I think, because who wouldn't want to work with someone who's willing to acknowledge when they were wrong and that you're right? It's so much easier than being in a dictatorial style or like an autocratic environment where the leader's always right. I mean, for the most part, like I said, and that comes back to my original thinking around, well, what are the things that I don't like, and just trying to not do those things. And I mean, it sounds easy, and it can be easy if you have the right mindset. And
Yeah.
it's very hard though when you're the smartest guy in the room. People think that they're the smartest person in the room. It's really hard to be wrong.
Right. It sounds like it also is good role modeling for your team members. Do you find that by behaving this way, others are more willing to come forward when they make mistakes too?
I think so. I mean, it's funny. What ends up happening after a period of time, at least that I've found, is that it just becomes a natural part of the dialogue and the discourse.
Right.
Hey, I thought we should do Y, and I was wrong. We need to do Z, and it's not even it's not even a second thought. It's just that's
Right.
what it is, and it's great because then you've taken that. The first few times it's hard for people to do that, but over time it just becomes part of your team's working culture. And you realize that it's okay to make mistakes, and we make mistakes. And usually they're small mistakes. 99% of the time they're small mistakes. The big mistakes, the reason we avoid the big mistakes is because we all talk to each other and we know that, we make decisions together. And usually, together we're able to chart a pretty good path. And so we're not going to make the huge mistakes. You might make a huge mistake by yourself if you don't talk to people. But you're de-risking those big mistakes by having the right team culture. So I found that over time, if I model that behavior, usually most of my teams will, start exhibiting some of that and just realize, and it just becomes part of the normal dialogue. And it's, I don't even think twice about it anymore.
Well, time has flown, Nihar, because we're actually hitting our end of our show here. But I want to say that you really, even maybe inadvertently, wrapped it up so neatly here by describing this whole idea of this communication and collaboration and being willing to make mistakes and be humble is what makes the team have better results overall. And that's what we're all about here on Reinventing Nerds, is helping people work together to achieve. So thank you so much for sharing your secrets to success.
No worries, Joanie. Thank you so much for having me on your podcast. This has been great.
Yes, thank you. And thanks to all of our listeners and viewers. We're here at reinventingnerds.com, and we'll see you next time.